Israeli offensive on Gaza City has raised new concerns for the civilian population, and in particular, children. Dr. Trish Scanlan is the medical co-director of Children Not Numbers, which helps provide healthcare and medical evacuations. Thanks for coming on the programme. Look, we're hearing that Israel's going to be issuing these evacuation orders before they move in. Where can people go now?
Well, thank you. I have just spoken to our senior paediatrician in Gaza City from Children Not Numbers, and he said that the hospitals have already been issued with an evacuation order. They've been told to prepare to leave Gaza City, that the date and the time will be imminent. And as he said, there are possibly 10 hospitals across Gaza City. He's at the Al-Rantisi Hospital, which is the children's hospital in all of Gaza. There are 250 children admitted there at the moment. There are 30 children in the neonatal intensive care. There are 5 children who are ventilated in the pediatric intensive care unit. And I don't know if your listeners are aware, but back in November 2023, Rantisi Hospital was evacuated then, and children were left in the NICU, in the neonatal intensive care unit at that point, and the doctors were assured that those children would be moved to safety. But when the siege was lifted on the hospital and they came back in March, they found the rotting bodies of those babies. Are we really going to let that happen again? There are 1 million people in Gaza City. Half of those are children, and there is nowhere for them to go. There is nowhere.
Trish, is the issue access in general, getting to the children, or is it where you go once you've got them out?
Do you mean out of Gaza City or out of Gaza in general? Sorry, I don't understand.
Out of Gaza in general. I'm just wondering, you know, when you make the evacuation, where are you taking them? Where are the challenges? Within, we know about the ones within, but what about outside too?
Oh, absolutely. So basically, when they're saying evacuate, they're not talking about evacuate out of Gaza. They're talking about evacuating the children to the south of Gaza, where there is nothing. The other question is also extremely important. So we, as an organisation, Children Not Numbers, we've evacuated more than 300 children from Gaza over the last 19 months. We are an organisation that concentrates on children who have a primary chronic diagnosis, children who have heart disease, or children who have cancer, or children who've had a stroke, or children who've had a catastrophic injury from this horror. And what has been incredibly challenging is the evacuation process is very complex. It requires permissions from the Palestinian Ministry of Health. It requires a permission from the Israelis, and we also have to have a third country who will take the children. And all 3 of those has been, well, our Palestinian colleagues, they tell us exactly who they will and will not authorise to move, and that's fine. We can stay within those criteria. But for the other children, it's very challenging. Perhaps if you give me the time, I can tell you the story of one child. We have a little girl who registered with us about a month, but her brother was registered with us before her. He was an 11-year-old little boy who 4 years ago had renal failure, kidney failure, and his mother was his transplant donor. And he was very well until April of this year, when his kidney started to look like signs of failure again, which was as a result of, the devastation that they're all living through. Mm. So the doctors, our colleagues in Gaza, did an amazing job of stabilising this little boy. And we tried from April until the middle of last month, again and again, to get that child out. And we could not get him out. And mid last month, his house was bombed. He and his 5 siblings were killed along with his mother. And his father and his little sister, who is now one of our patients, were caught in the blast. They were burned. They were broken, and now we are trying to stabilise her and help her get to safety.
So, unfortunately, more stories like that, I'm sure. Dr. Trish Scanlan, thank you for sharing that with us. Dr. Trish Scanlan, Medical Coordinator of Children Not Numbers.